Hi, my name's Janet, and I love using these yoga tune-up therapy balls to massage my shoulder region. As a part-time Pilates instructor and a full-time flight attendant, they're great for warming up for my exercise or for relieving tension, soreness in my muscles after 12 plus days working on an airplane. So let's get started. I'm going to take these balls and I'm going to place them in between the shoulder blades on either side of the spine. And I've got my head on a yoga block, just helps me a little bit better for positioning. And now I'm going to exhale and contract. And inhale, release, relax. Exhale, contract. Now this method of contract, exhale, and relax is also called PNF method, which is proprioceptive neuromuscular facilitation. And what I'm targeting right now is the trapeze muscle, which is not actually a muscle of the shoulder, but it lies on top of many shoulder muscles. And I like to start off this way, warming up this muscle. Once it's hydrated with better circulation, it moves over the other muscles very nicely. It slides a little bit better, more efficient. And this muscle is responsible for rotation and adduction, squeezing the shoulder blades together. It's also for depression down and for elevation, like when we shrug. So there we go. We're going to move on to the supraspinatus. Now the supraspinatus muscle you can find by following your shoulder blade. There is a bone, which is the spine of the scapula. And it comes right up on an angle here. So just right up above that, that's where your supraspinatus is. So I'm going to get into this region. Again, I'm using the yoga block. This is a rotator cuff muscle, and it also assists the deltoid in abduction. So now I'm going to go up into a bridge, and this helps me to really get some weight and some penetration. Sustained compression is the technique that I'm using right now. And you want to breathe. You don't want to hold your breath. The higher I come up into a bridge, then the more I can have my body weight going down onto this muscle. And the trapeze does lie on top of it. So this is great to really get down, to totally get to that supraspinatus. Breathing as I do this, and I grow a little more tolerant of some of the discomfort of getting this deeper penetration. Now I'm going to do cross fiber technique. So I'm staying up here, got my body weight. I can control how much I can come down a bit or go up a bit more. And I've got the body weight pushing the balls deeper in and cross fiber sliding up and down over this muscle. Bringing more circulation, breaking down adhesions, and releasing some of the fascia buildup. So now I'm going to, that same spine of the scapula that I was telling you about, we're now going to go just below to this area where the infraspinatus, teres minor, and teres major muscles are. Now these are rotator cuff muscles as well. And they are responsible for external rotation, internal rotation, and also shoulder adduction for the teres major. So my landmark is to go onto that bottom point of the shoulder blade. And when you get there, you can feel it. So I'm going to do a pin and stretch motion. Now this is the bottom, it's the inferior angle of the shoulder blade. And what I can do is once I'm on there, on that one point, I can lift a limb and bring it back down. Shoulder flexion and extension. I can also move my arm around in a variety of motions, like a conductor for the orchestra. And I I really feel it radiate all the way up through into, from the teres major to the teres minor to that infraspinatus. And then I'm going to move on to a stripping technique. So I'm going with the grain from an angle from the inside lower part of the shoulder blade and up to the top of the arm bone, the humerus, where they attach. That's where the infraspinatus and the teres minor attach. Teres major attaches a little bit lower down onto the humerus. And sometimes you have to readjust your position, but it's really nice. This stripping motion, I love it. And it's like the pastry chef rolling out pastry with a rolling pin, lengthening out the muscle. These rotator cuff muscles, as a flight attendant, we do way too much external rotation, internal rotation with heavy coffee pots and heavy water jugs. And this is a very important exercise, I think, for shoulder region. Now we're going to move on to the deltoid. Now the deltoid, you've got 3 heads of the deltoid. In front, middle, and back. So this posterior one here, which attaches to the scapular spine on top, I'm going to do a little sustained compression there. Now, the deltoid is responsible for shoulder flexion for the front, the anterior. The middle one, or acromial, is for shoulder abduction, and this rear one for extension, shoulder extension. And we're in and out of those seat belts, those shoulder straps, harnesses. You got to go those arms back, and you get a little sore and sensitive. So this is great, a great place for me to target with sustained compression. Then I'm going to roll around, and I'm going to do a cross fiber motion, getting all 3 of the deltoid heads. From the cross fiber, I'm going to move to some more repetitions with a technique called the stripping, which we did before, lengthening out these deltoids. And I really need to do this because this is my most sensitive area in my shoulders. I also have a shoulder that dislocated with scar tissue, so I like to sometimes get right in there and break down that scar tissue. That's been there for way too long. And at the end, right where all of those pectoral deltoid heads attach, that's right into the middle of the humerus here. And I'm going to take one of the balls, and I'm going to do a little skin rolling, and I'm going to stretch the fascia. And that feels really good. And when I finish here, I'm going to do the other side. So if you're thinking of giving yourself a little massage in the shoulder region, you need it like I do, I suggest you get yourself some of these. Thanks for watching.